Hello, I'm Megan Miller, and this is Equities, Disparities, and COVID-19 in Switzerland. I'm going to start by talking about the overall health status of Switzerland people. And Switzerland is a country with one of the highest life expectancy, where women are expected to live for 85 years and men for 81. That's according to the World Health Organization from 2015. And the most common causes of death in 2010 were due to non-communicable diseases that include cardiovascular disease, cancer, respiratory disease, and mental disorders. And so next I want to talk about the healthcare system in Switzerland. And it is pretty unique in that it's regulated by state and private sectors, and mandatory health insurance is required for all citizens. And so the Swiss healthcare system is rated in terms of three factors, which include general performance, clinical outcome, and sustainability indicators. And based on these three factors, the Swiss healthcare system is considered above average because of its equity and sustainability. And this contributes to the reason why the Swiss might be an advantage to fight COVID, because it can sustain economic instability. And then this is a chart that illustrates the breakdown of healthcare spending in Switzerland. And as you can see, only about a third of the current spending is coming from out-of-pocket expenses, while the rest of the spending is mainly coming from prepaid private spending and government health spending. And so now I'll talk about some of the main health disparities. And according to the World Health Organization, suicide rates are higher in Switzerland than the European average. And this makes suicide the fourth most important cause of death among the Swiss population. And also, degenerative mental disorders such as dementia are expected to increase with the aging Swiss population. And so these disorders already impact at least 100,000 people in the Swiss community. And so it's just expected to increase. And then finally, chronic diseases such as cardiovascular disease, cancer, and respiratory disease are also expected to rise with the aging Swiss population. Okay, and then this is how the pandemic has impacted the Swiss economy. It's impacted it in many ways, but one of the biggest ones was in the workforce. And approximately 30% of Switzerland's workforce transitioned to short-time work, and unemployment also rose to almost 3%. And also tourist events, for example, the Geneva International Motor Show, which is a big stimulator for the local economy, which ended up being canceled, which resulted in a major loss in revenues in many cantons all over Switzerland. And then finally, trade with China was decreased, even though Switzerland and China are big traders. Like Switzerland gets 7% of their trade from China. The result was a reduction in product turnover within Switzerland. And so next is the COVID-19 impact on health. And about 81.9% of people within Switzerland who ended up getting COVID ended up recovering also. However, the fatality rate of 5.9 was also seen in Switzerland. And so since there were only about 1,200 ICU beds available in all of Switzerland, the whole medical care system needed to be rearranged to compensate for how many cases they were seeing. So private medical practices and clinics offices were asked to treat COVID patients and to make regularly scheduled procedures less priority, so that they could help all the people who were sick with COVID. And then this is a map that just kind of lays out the spread of COVID all throughout Switzerland. And so the more dark red ones signify higher cases. And then the canton, which is called Ticino, is one that neighbors Italy. And since Italy was a country that was very impacted by the pandemic and which had the toughest shutdowns and had the highest amount, like a high number of cases, we're seeing that as one of the Switzerland cantons that had the highest amount of cases and also highest percentage of fatalities because it was shared a border with Italy. And so that is all that I have. These are my references. Thank you.